Welcome to the question and responses for children in chiropractic. Now, please like this video and share this vital life-saving information. It's going to help us grow our channel and hit that subscribe button. Let's change the world. Question 1 from Time for It 5702. Isn't this neck cracking thing dangerous for children? It doesn't sound or look so safe. That's because it's not neck cracking. I mean, what we're doing, okay, and with a child, it's so easy. We're using less than a half a pound of pressure, okay, and we always, before the adjustment, we're going to take an x-ray to see what the body looks like. Now, if you have a structural deviation in a kid, like let's say they were born with a mom getting Pitocin, that can cause damage. If the kid was born C-section, that's 4 times the amount of pressure on a child's neck. And when you're looking at colic, you're looking at digestive disorders. This is all relieving the pressure off that central nervous system. We even teach parents to do a sacral pump on infants to help them fart or poop. It helps their digestive tract because every human being, we all have this automatic nervous system, and you could be in stress or regeneration. And that regeneration is called rest, digest, and repair. And that's located in the neck and the pelvis area. And you'll see to do the traction on an infant, you just hold the child upside down, just a little bit of an angle. It requires almost no pressure. And kids respond so well. There's very little cracking, if anything. I've never, on an infant, there's no pressure built up in the joints. So they respond so well by just relieving that pressure off that nervous system so their body can adapt correctly. Because if that pressure is on that nervous system, putting that child into stress, you're looking at resting, digesting, repairing, literally development is going to be challenged. So getting the kids checked to make sure their nervous system is clear of interference so their body can adapt correctly is vital. You just got to see the kid adjustments in real life. It's amazingly gentle. Question 2 from Revelation Freedom Ministries. You should take your child in almost instantly after birth, especially if they were born through C-section. Absolutely. You're looking at 4 times the amount of pressure on a child's neck being pulled out of that mom. And this is far too common, particularly in America. And just know that what the adjustment does, it removes interference off the nervous system. Nervous system controls and coordinates every function of the body. And when these kids are physically stressed, it's hard for them to adapt and to assimilate nutrients. This is why so many constipation and bowel disorders are corrected very quickly through an adjustment. It's like amazing, a miracle. This is why I say during every birth process, you've got to get the kid checked. And this is why we get kids 2 and 3 days old in the office, because the relatives saw this kid being born and they saw them bent, turned, and twisted and pulled. Yeah, that is when you absolutely have to clear that kid's nervous system of interference so their body can adapt correctly. And literally, I do teach every parent ways that they can relieve pressure on that nervous system by doing the sacral pump, or by changing their sleep environment, or by stimulating the kid's immune system by flipping them upside down and around, because that stimulates certain areas inside of the brain, particularly the semicircular canals, so that the body can get more stimulus, more input to that brain, so the body and the brain can adapt correctly. It's absolutely vital, especially after C-section. Question 3 from K's Worksick. What if a kid is afraid of a chiropractic adjustment? How do we encourage them to visit a chiropractor? And that's the cool thing with kids. Kids understand. Now, when kids have some neurologic issues, such as social interaction, they've been in a chronic stress state for a long time, I'll literally adjust them in the kids' area where they're playing. And then we have little stuffed animals. All the stuffed animals that we have in all of my clinics, they have little clickers in the back. And so the kids literally will take the stuffed animals and they'll put them on the chairs in the waiting room, and they'll be adjusting all the animals. And I'll say, thank you for adjusting them. So it's really fun. Kids don't need to be convinced, and they get immediate results, and so they love it. Kids are open, accepting, and understanding, and they really get it. It's like adjusting puppies. Puppies don't have to be educated. They just know that after the adjustment, they feel better. And one of the first presents I ever got when I was in the student clinic, this little kid gave me a little tiny stuffed rabbit, and it was for taking his coughing away, because he'd been coughing every day for about 2-3 weeks. And it's just so beautiful to see these kids understand that their body is self-healing and self-regulating. This is the greatest introduction. And I think how my life would have been different if I was introduced to chiropractic right away at the start. It empowers the kid, empowers the child, that their body is adapting correctly. And even when I'm teaching at the bamboo school in Thailand, kids get it. I say, "Where's your tummy? Where's your tummy?" And they point to the tummy. "And where's your brain? Where's your brain?" And they point to the brain. And then I say, "Yeah, that brain controls the tummy. That brain controls everything." And explaining that nervous system. Oh my gosh, kids are hungry for knowledge. And when they know that their body is so smart, and I say, "Look, your body, you can eat a mango and a banana, and literally your body's going to break down those foods, and it's going to make blood and skin and bones and hair. I mean, you're building your body with what you eat. So this is why what you take into your system is very important, because it literally becomes you." And to teach kids what we used to be taught in school, that what you eat becomes you. And this is why you pray over the food. I mean, it's just such a brilliant, brilliant way to have them understand how their body works. It's a fantastic education, and kids love it. And this is particularly the kids that are neurologic damaged. And I'm talking anywhere from ADD, ADHD, asthma, bowel disorders, all the different neurologic issues like autism and just speech delay, all of that. Kids get the big picture easy. They're smart. Kids are smart. Question 4 from SL Slater. Okay. Outstanding information, Dr. B. I'm going to your clinic in about a month. So excited to go. My question is, my granddaughter is just over 2.5 years old, not speaking at all. Lots of interactive vocals that sound good, but no words. Has some eye contact, no behavioral issues, ignores all attempts to get her to respond to her name. Never received any intervention from day one, no injectables or medication. Is it possible to just be a late talker? Is more going on? Always been a great sleeper, ignores her new little brother completely, and he's 5 months now. I'd love to bring her with me to see you. Not sure if her parents will let me. Thank you for all you do. If not speaking is common, and thank God there's been no interventions from day one. But now we got to look at the gut, because if the mom was given Pitocin or had milk let down during the child's development, and if the kid was exposed to formula, the majority of formulas, particularly recommended by pediatricians, the majority content is genetically modified high fructose corn syrup. So that is not good for brain development. And we got to look at the gut brain. She may have a little paunch belly. Okay. And if you feel her tummy, and this is like a really, really good thing to expose the parents to, if you touch your cheek with, just a normal cheek, that's what a tummy should feel like. If the cheek is expanded out and it feels almost like a balloon, if her tummy feels like that expanded out cheek, then you know that there's some kind of gastrointestinal stuff going on. So look at stuff that she'll accept, like coconut yogurt is excellent. They even have a frozen coconut yogurt with living bacteria in it that is fantastic. So look at dairy can be sometimes toxic to the kids. Raw dairy can actually be beneficial for the children, but we got to build that gut flora in her tummy area. Knowing that she sleeps good, thank God, that's going to be everything. But now we got to get neural stimulus. So getting the kid to walk or run, and look at the kid's posture too. because to get neurostimulus, we need movement. And so this is why gymnastics, moving the kid upside down, backwards, around, flipping that kid around physically, okay, supporting the neck, obviously, you don't want to shake the kid, but to experience that kid, this is why hanging upside down is so good. This is why gymnastics is so good. Yoga is really good for kids. All different types of movement will stimulate that brain activity, and look for cross crawl activities. And this is one of the things that we do for all of our kid patients and our adult patients is after each adjustment, we get them to swing their legs. And what you'll find, and this is a good education for the parents, sit the kid where they can dangle their legs in a 2.5, that won't be hard, and just have them swing their legs, but try and swing their legs even. And you're going to see that they may have trouble maintaining that rhythm. And the more that they can practice that, and it's also helped let a kid tap something with their toes, like a trash can, the back of a chair, something, a stuffed animal, so they can get more stimulus up to the brain when they tap stuff. And you'll see the more rhythmic, the more symmetrical movement they have, the better the brain function. So getting them to do symmetrical activities, running, biking, any kind of activity, and look at the brain development is directly connected to physical movement. So get her in a lot of different activities. And I'm talking really good stimulus activities where she's running around barefoot in the grass or barefoot in the sand. That gets more stimulus up to the brain. Climbing, hanging upside down, backwards, giving her brain those challenges to where she can start to adapt. It will be amazing. The physical movement directly equates to brain function. And I'll help in any way I can. Bring her in. We can, talk to the parents. And then this way I can show how to recognize if there is a neurologic deficit and how to correct that with just activity, exercises, and playing. Also, if she had ear infections at all, 97% of ear infections are ear effusions. That means it's sterile, but they're just filled up with fluid. And that indicates an upper cervical trauma, which could have happened from birth, particularly if the mom was given Pitocin. And that can initiate uterine contractions, which can strain the infant during the birth process. So ear infections are a big clue. And then typically a pediatrician is going to give an antibiotic for an ear infection, and that's going to damage the gut flora. So there's a lot of different things. You can also have the kid turn their head really, really far to one side and really, really far to the other side. And you may see an asymmetrical movement. And 50% of that turning of the head occurs at the top joint in the neck. So there may be a subluxation pattern or an area of trauma that was experienced during birth. And if she had birth trauma, this means that her body, because every human being has this automatic nervous system, stress or regeneration, that's the only two switches a human's got. And if they're in a physically stressed state, then their neurodevelopment could be limited. So I'll help in any way I can. God bless you for being aware and for wanting to help. I'll help in any way I can. From Alyssa and her son, Alyssa Ryan. We've been treating our son for what appeared to be autism spectrum disorder, who's sudden onset at 1 year old. While my son made a massive recovery through what we've been doing, Dr. Bergman and his team aligned our son so well the first week. He had a detox fever and then spoke a full age-level sentence after a year with a speech pathologist, resulting in minimal improvements. I mean, 2 to 3 word sentences were normal then. A week later, 5+ word sentences were normal. Just incredible. I'm so glad we took the leap to try chiropractic, and Dr. Bergman in particular. God bless you and the work you continue to do. When you're working on kids, you see them come alive. You see them be more aware of their environment. And this kid is amazing. He was so apprehensive because he'd been to a number of different doctors, and none of the doctors are going to help. And because they're all looking for a chemical that they can give to him, some type of medication, a drug, or something. And then if that's not working, then they and send them to a physical therapist or a speech therapist. And you've got to look at neurologic development. And kids respond so well. They're designed to grow. They're designed to adapt. And if you clear that nervous system, which controls every function of the body, you get more stimulus to the brain. And if both halves of that brain are working correctly, or both halves are getting good stimulus, it's fantastic. And her son was amazing. Okay. And what I do to calm down kids who are hyperactive or apprehensive, I just talk to them. I play with them. Sometimes I'll have to adjust kids in the kids area where they're just playing with stuff. And it's so easy. It requires almost no pressure. You're talking about a half a pound, but it's mainly brain stimulus that we do. And this is why her son recovered so well and so rapidly. And kids do get the big picture. You're looking at very, very fast results. And this is the ultimate mom, because she modified his diet, got him on healthy fats, healthy foods, built his gut flora with probiotics, prebiotics. I mean, she was brilliant, is brilliant. And they do say kids pick the parents. So he chose well. He chose well. God bless you. Glad you're doing well. Now, if your question wasn't answered, please go to the drbvip.com site, the drbvip.com. There we can answer freely, and we can go more in depth into subjects that may be challenging to the environment that we're in. God bless you. These were great questions and comments. The world was built for you. You were built for the world. Okay. And the kids are our future. This is the most important asset to our planet that we have. We got to take care of them. God bless you all.